So, hi everyone, and I'm really very excited to be with Dr. Paras Mahajan once again. Rank 44 INI CET, and now guess what? A rank of 20 in the NEET PG 2022. So, heartiest congratulations, Dr. Paras.
Thanks a lot, ma'am. Thanks. It means a lot.
कैसा लग रहा है मतलब I think 44 INI CET was a awesome rank और उसके बाद amazing rank once again. So what was your first feeling?
I was feeling really happy. Like I got, I don't know if I deserve this rank or not, but like I really
अरे
feel.
मतलब obviously you deserve. Without deserving वालों की तो आ ही नहीं सकती ना. Deserving वालों की भी नहीं आती कई बार.
Yes, ma'am.
See
Yeah,
how much modest he is. Modesty comes, है ना?
it feels really great that I got this rank, and means I'm really happy about it.
हाँ तो expected था पारस. INI
I
CET के
expected
बाद
like
लग रहा था कि हाँ इससे भी बेटर आने वाली है मेरी रैंक नीट पे.
I was expecting like between in under 50 only, but
अच्छा.
yeah.
तो वेल विद इन दी था ना अंडर
Yes,
50
yes,
यू वर
yes.
एक्सपेक्टिंग. ओके. तो पारस थोड़ा सा इंट्रोडक्शन दो कैसे डीबीएमसीआई से आपकी जर्नी स्टार्ट हुई थी.
So like my journey started with the DBMCI in the second year. So in second year, I attended the second year subjects classes mainly, and then I attended the third year classes in the third and final year classes in the third year. So I mainly made the notes in the second and third year, and did not focus much about solving the MCQs. So in final year, I refined those notes and mainly focused on the final year, and those I refined those notes, added to those notes, and did the question bank. And in internship, I focused mainly on T&D and revising the notes.
ऑल राइट. तो आपकी आई थिंक डीबीएमसीआई के साथ जर्नी काफी पहले से शुरू हो गई थी. आपने नोट्स मेकिंग किया एंड आई थिंक वो एक इम्पोर्टेंट पार्ट था नोट्स मेकिंग का. फिर कौन सी क्लासेस ज्यादा अच्छी लगी पारस भाटिया में?
Like all the classes were good, like pathology and pharma classes in second year, then medicine and surgery classes in third year. So means all the anatomy classes for the first year. So all the classes were really good, and T&D sessions were also like very high yielding. So like means they focused on all the previous year topics and important topics.
लाइक भाटिया के टीएनडीज हमेशा से रहे हैं गोल्ड स्टैंडर्ड. तो आपको क्या लगा कि क्या सबसे अच्छी चीज लगी? स्ट्रैटेजी, क्वेश्चंस, व्हाट वाज योर बेस्ट एक्सपीरियंस?
Like the one thing was that those students who are not consistent, they can like really follow T&D and means keep on studying. Otherwise, they will lose the track because there is a lot of uncertainty while preparing, and means some students procrastinate also. So T&D is one thing is that T&D is really helpful in setting the schedule. Second, means you are given the time limit and you are able to like means do the subject in those days. Otherwise, you will always procrastinate. And regarding the questions, the questions were really clinical in the T&D, and the same were asked in like NEET also. NEET was also highly clinical, and means they focused on the important topics also and on the means these updates also. So like it was a good mixed bag of the questions.
मतलब लगता है कि जो टीएनडी यहाँ से मिला आपको भाटिया से वो था कंप्लीट द क्वालिटी एंड एवरीथिंग?
Yes ma'am, definitely it was complete, and means discussions were also high yield. So I used to means like make these separate notes for the T&D. So in the last, I did not have much time to go through derma notes between INICET and NEET. So I went through the T&D only, and like all the questions came from those T&D notes only. Like all the 5-6 questions I was able to do through T&D notes only.
Okay. So, Paras, how do you suggest your colleagues or your juniors to make the best use of this, like DBMCI TNDs? Because, like you, every student always praises our TNDs. So, what is the best way of utilizing these according to you?
Like I would say that first try to stick to the schedule. But even if you are not, like some people have internship, hard means difficult internship. So even if you are not able to stick to the schedule, the means you can watch the recorded sessions and make the separate notes for the TND, I would say, because they are really helpful in revising at the end.
Yeah.
And means always give the paper before like discussion. Don't like start the discussion without giving the paper. And try to go through your notes at least once before giving the exam also, so
Okay.
that yeah, means what to add and what to focus more on.
Mm-hmm. So,
So like
which TNDs you liked most?
my like surgery TND, anatomy, then I like means ENT ophtha TND and medicine TND. They were really good. And orthopedics TND also.
Right. तो कैसे लगे भाटिया के नोट्स? आप तो शुरू से पढ़ते आए हो, तो यू नो द बेस्ट.
Ma'am, I made my like handmade notes also, and I used the printed notes also. For few subjects, I used the printed notes also. So means through the eGurukul, I found it very helpful to navigate to the notes. There was option to navigate to the subtopics and topics very easily.
वो जो
So
टाइम
that,
स्टैम्प फीचर है, you are talking about that.
no, even in the app also, like you are able to navigate very easily to the notes, and you can
Yes.
open it and like go through them. So that means that option was really really very helpful.
ओके,
eGurukul.
तो मतलब ये कि कहीं अगर हमारा कोई लेक्चर छूट जाता है तो वी कैन कवर अप फ्रॉम eGurukul. eGurukul क्यों बैंक किया आपने? तो हाउ वाज योर फीलिंग अबाउट दैट?
QBank, like it was really clinical now. Means now it is made clinical. But like in the real paper, there are one-liners are also asked. So those are also you need to do, because in Indian exams, it's not like means almost it is like not like USMLE. There are gonna be like
बिल्कुल.
factual questions also. So
And that is the
so-
reason that we have actually kept 30% one-liners also in
yes, ma'am.
the
They are also like
eGurukul.
very important. One-liners are also very important, and facts are also important.
बिल्कुल
Because
बिल्कुल. इवन क्लिनिकल क्वेश्चंस करने के लिए भी पारस
हाँ
फैक्ट्स चाहिए. विदाउट
हाँ
फैक्ट्स आप क्लिनिकल क्वेश्चन भी नहीं कर पाओगे.
yes, ma'am.
ओके. तो हाउ फ्रीक्वेंटली यू यूज टू गिव द टेस्ट? क्योंकि टेस्ट देना आई थिंक यू विल से कि
Like ma'am,
इम्पोर्टेंट है.
T&D I used to give after revising the subject, and grand test I started giving the grand test means like in the middle of the final year. So I used to give once in a month, and
Okay.
in the internship I started giving once in 2 months, and then the frequency started on increasing. Like in the last I was giving once in a week, and in last 10 or 15 days I did not give a grand test. In last
अच्छा,
like
तो यू केप्ट ऑन इंक्रीजिंग द नंबर ऑफ टेस्ट. तो कैसे करते थे? व्हाट वाज योर वे ऑफ रिव्यूइंग द टेस्ट? जैसे कि आपने नंबर बढ़ाया, तो हाउ डिड यू मैनेज द रिव्यू ऑफ द टेस्ट?
earlier it used to take a lot of time to review the questions. It used to take 2 to 3 days.
हाँ,
But
क्योंकि दैट इज अ वेरी चैलेंजिंग जॉब आई थिंक.
but once you get used to them, then you can like skip the correct ones. Some means like the topics are also repeated in the GTs also, so you will get to know that which topics are important. So it means like if you have less time, I would advise that you can go through your guessed questions and your incorrect and left ones. So that will also be like okay, means good strategy. But if you have time, you should go through all the 200 questions.
Okay.
Means I think that you can add, I mean, if there are any new points in the GTs, so you can add them either in your 20th notebook or in the same notes also.
Okay. तो कैसे थे? मतलब आपने तो, क्योंकि यू स्टार्टेड वेरी अर्ली एंड यू गेव सो मेनी टेस्ट, है ना, लास्ट में यू गेव सक्सेसफुली. तो भाटिया के टेस्ट है या एसडब्ल्यूटीज, टीएनडीज यू हैव गिवन ऑल, कैसे थे?
Yes, when the questions were really good in the like grand tests, so they were like really mind involving questions. So means I used to get tired after giving the Bhatia GT. So yeah.
अच्छा,
And there were
सिमुलेटिंग
new
लगे?
questions also.
सिमुलेटिंग थे
Yes,
फ्रॉम द
ma'am.
मेन पेपर?
Yes, they were definitely. Yes, ma'am. NEET के तो like काफी simulating थे.
कुछ क्वेश्चंस ऐसा लगा कि
like
सेम आए या रेप्लिकास थे या सिमिलर थे?
yes ma'am, yes, definitely they were, I mean I did not remember like many of the questions from the NEET, but yes, they were like I have done like most of the questions earlier also.
अच्छा, और इमेजेस
Like,
कहाँ
they
से
were
करी
simple
थी आपने?
images ma'am, like mainly I did from the notes also, and then like teachers used to provide the PDF also after the class, you know, like
वाइप
they
किया था?
provided vibe ma'am, yes I did for the medicine, opthal and surgery and anatomy.
अच्छा,
Yeah.
तो डिड दे हेल्प?
Yes ma'am, definitely they help.
क्योंकि
Like
आई थिंक ऑफ्था में कितने
what
इमेजेस वाले क्वेश्चन ज्यादा थे इस बार पारस?
yes ma'am, there was the pseudo exfoliation syndrome type, and then there was intax was there for
इंडेक्स पे
keratoconus.
था।
That exact image I did see before the exam, so it came.
और बाइट डॉट स्पॉट्स वाली भी नोट्स में से थी?
Yes ma'am, vitamin.
और कौन सी इमेज थी? आई थिंक 5 to 6 इमेजेस आई थी इस बार ऑफ्था में, काफी इमेजेस थी। और
Yeah,
डायबिटिक रेटिनोपैथी,
I
और एक क्वेश्चन तो हम लोग वही डिस्कस कर रहे थे अभी कि क्यू बैंड से ही था, स्क्लेरोमलेशिया परफोरेंस वाला। एग्जैक्टली
that I also I got that question wrong in the GT.
हाँ वही तो।
So it
तो
was the
मैं वही
first
कह रही
question
थी
in
कि
my NEET
ऐसा
exam.
नहीं है, पहले हम लोग सोचते थे कि इस टॉपिक से तो क्वेश्चन नहीं आता, रखें या ना रखें
But
जीटी में, वो बहुत चैलेंजिंग हो जाता है। जीटी
yes
में
ma'am.
एक एक क्वेश्चन सोच के रखते हैं, लेकिन देखो
Like I was confused in that question while giving the GT how to rule out between ciliary staphyloma and
सीलियरी स्टेफाइलोमा।
scleromalacia perfurans.
हाँ
So that I immediately marked. I was very happy that.
हाँ, तो जब गलती पहले करी हुई होती है तो फिर वो मेन एग्जाम में याद आ जाती है पारस। आई थिंक
Yes,
गलतियों
yes
से
ma'am.
हम सीखते हैं। ऑलराइट, तो क्या एक्सपीरियंस है? कौन से सब्जेक्ट्स लगे कि भाटिया के गोल्ड स्टैंडर्ड है नोट्स, और क्रिस्प
Like
एंड
all the
कंसाइज?
subjects are gold standard. I think that you should focus on one source for each subject, and you should really trust the faculty, and means they are really experienced, and you should really trust them, and then only things will work out. If you will moving from one source to another, then it gets difficult. So yeah, at the end, like if you even remember like the most repeated topics and high yield topics, then that will also get you a good rank.
ऑलराइट, तो any piece of advice, anything that you would like to say, give a message to your colleagues and juniors?
I would just say that like while preparation, there will be many thoughts and uncertainty. So don't think too much. Keep targets for next 1 hour, next 2 hours for a day, and keep on achieving those targets. Don't think like too much in the future, and don't regret also. Like some days you are gonna waste, and means you will not be able to study. And if you are having an internship, even if you like study, like even if you study for half an hour a day in those hectic days, then that is also like all right.
All right. So amazing message and amazing ranks. We are very, very proud of you. You have done wonderfully in both the examinations, and we are very happy that we were a part of your journey, successful journey. And we wish you all the very best for your future endeavors also. May we again see you in the interview table and for the SS preparation, Paras.
Yes.
Thank you.
Thank you, ma'am. Thank you.
Thank you. God bless.